started the show, I mentioned that Rafiq Salam had filed a rather bizarre story for us. So here we go with the details of that. A 70-year-old old woman was hacked to death by her mentally ill biological daughter of 35 years at Danku in the Wa municipality of the Upper West region. The incident took place at the outskirts of the community where the duo has been digging for stones for sale. The suspect is alleged to have inflicted multiple machete wounds on the arm, waist, and head of her the mother that she killed. So here's the story as told by Rafiq Salam.
Danku, located at the outskirts of the one municipality, is in a state of mourning and disbelief, and yet to come to terms with the alleged hacking to death of a septuagenarian mother of 4 by her own biological daughter of 35. Ajere Sedu, since her childhood, has been following her septuagenarian mother to the outskirts of the community to dig for stones to sell for the upkeep of the family, a job that she mastered and loved, and has even passed it on to her 2 children, who are between the ages of 7 and 5. After helping the mother to dig for the stones, Ajara will usually look for firewood for sale or for domestic use, leaving the children with their grandmother. Everything was going on well until one of his children, in an attempt to break one of the stones, had part of the stone going to the opposite direction to hit the grandmother, who just infuriated her. 7-year-old Wakilu, in a pensive mood and with tear eyes, told Joy News what happened. My mother was angry why my grandmother should beat me, and she swore that she will cutlass her. I pleaded, but she said repeatedly, I will cutlass her today, I will cutlass her tomorrow. She then went to my grandmother and hit her on the arm with a machete. I was pleading for her to stop, but my mother wouldn't listen. In an attempt to run away, she slipped and fell. My mother then inflicted multiple machete wounds on his head. The children ran home crying and delivered the bad news to their uncles. They came, met her lie prostrate, and in between this heap of stones, son of the deceased, Ibrahim Mahama, who is a son loader, told me the family is shocked to the marrow about what transpired.
When I saw my mother lying in a pool of blood, I couldn't believe it. But what can we do? The dead is our mother and the suspect is our sister. Both of them are for us. If not, we would have also beaten our sister to death.
Mr. Muhammad revealed that her sister has been mentally ill for close to a decade.
She has been sick for long, and we have gone to one hospital to the other, but has never been cured. She is always with my mother, and they are always together. We cannot say anything. That is God's way.
The deceased was taken to the Upper West Regional Hospital morgue for autopsy, but has since been buried under strict Islamic tradition. The Upper West Police Command has also confirmed the incident to Joy News and has also started investigation on the case. Reporting for Joy News, Rafiq Salam, Danku.
All right.
Very tragic story there, but it also opens the bigger picture, and this is not the first time. We've had a series of events, I think, since last year, about mentally deranged relatives who tend to put their other parents or elderly people or people around them into that state. Also opens a question about how the state tends to care for mentally deranged people, because we've had bigger stories about mentally deranged people, people who have psychological problems, psychiatric problems, who open bullets or guns on people in the US, etc., in the more developed areas. And you can say, if this is cutlass. If guns were available, you could imagine the extent of damage and loss.
I think the heartbreak for me is the fact that that 7-year-old boy witnessed it and you know he narrated that to Rafiq Salam. But let's talk to the police now. Superintendent Hussaini Musa Winaba is the war crime officer. Good morning to you, sir. Thank you for joining us.
Good morning, and to you and your listeners.
Yes, sir. So how are you dealing with this matter? Are you arresting this woman who killed her mother?
Yes, it is a murder case, and we have to arrest any suspect involved. Unfortunately, he was arrested on the scene and then brought to the house, and the police were invited to go and bring him to the police station.
Well, what kind of states is this woman in? Because we're told that she has a some mental challenge.
And that is why we're also here. So we are yet to send her to the court for to follow the necessary process, and if the necessary directives are given, we will send her to the mental hospital for a checkup.
So for now, where is she being kept?
She's at the police station in our police custody, and we are preparing her for court today.
What kind of mood has she been in?
Oh, definitely, it's in a neutral mood. Doesn't seem worried about whatever happened. So we cannot determine her mental state now. As I said, we'll have to put her before court for the necessary orders to be given. Then we'll put her before the mental hospital for a checkup. But we have been informed that she has been attending the Tamale psychiatric unit for receiving treatment.
Okay. Is this a woman who's been involved in something close to this before in the past?
No, this is the first time that we hear of such a crime against her.
So what's going to happen to the children? I mean, I care very much about the son who even witnessed the incident. Is the police extending any kind of support to the children?
Yeah, they are here to come to us, and if we see that they need any specialist attention, we may have to let them see the psychiatrist for any proper professional advice or treatment.
Just before you go, when is the first court appearance?
Pardon me?
When is the first court appearance?
Yeah, the court will come on probably today. We don't know whether the court will sit. If the court will be sitting, then we have to put her before court today.
All right, sir. We will let you go, and we will catch up for more details as and when you do have more updates. That's Superintendent Hussaini Musa Winaba, who is a war crime officer, telling us about the police angle to the story. The woman in the center of this role, and she's been arrested. She's in the grips of the police. They are hoping that they can appear before court today. Otherwise, you know, we will update you on this issue. I asked about the children and if there was any support, but I have a feeling deep down that that's not an angle the police even cares about.
No, they don't. Well, I think we also have to give the police the benefit of the doubt. We have to cut them some slack. When a crime happens, they look at what happened, who the suspects are, and try to investigate. So those are the things they'll look out for. And then we have other state structures that are supposed to care for the other residue or the remnants that fall off the case.
Yeah.
And we're talking about the social welfare system and all that. We don't have a very strong social welfare system. And you can imagine, even in Accra and more urbanized areas in our country, it is worse. So you can imagine outskirts of those brackets of those societal geographical specs.
That's true.
It's going to be a lot more difficult.
Oh, this is sad.
Yes, it is.
I wish this had not happened.
It's about the state of mental health and the way we take some of these things seriously.
It brings to mind, you know, sometime last year, I had an extensive conversation with the man in charge of the Mental Health Authority, Dr. Akwesi Osei. And and that was the first time I was hearing that there were people with mental difficulties or mental ailments who, just like in this case, this woman is referred to the psychiatric hospital. People just like this woman in this story who are kept there for so many years because the court refers them to the hospital for them to check up on them, as in some medical examination for them to report back to the court. When they are done with the examination and sometimes are done treating them, the patients are still kept there. So in this case, they become patients and they become suspects, murder suspects, patients still kept in the psychiatric hospital after so many years. Yeah, it's sad. This is
yes,
where we are.
It's sad, and we know this one is in the Upper West region.
Yeah.